Mercia, I am studying BN journalism, and this is Tastri.
I'm Andrew Bdzic. I'm studying chemical technology and my final year at MCAS.
So, my first question for you, Andrew, is medicated marijuana has become legal in Malta recently. Do you think that this will have an effect on the illegal use of marijuana?
No, I don't think it has an effect on. I don't think it will affect it at all because if people are using it legally, I mean they're using it for recreational uses, not for medicated uses. So I don't think they're related.
So, you are sure that this case scenario where medicated marijuana has become legal to patients who are maybe require this use. So you're saying that there is a different distinct between.
Yeah, definitely. I mean, if you're using it for actual use, I mean that's one thing. But if you're just using it for to just relax and recreational
I
in your
see.
recreational time, it's different. I think, yeah.
In America, there is a statistics that says that 19% of the population who consumes this drug is addicted to it. What do you think?
Okay, it could be reliable information that it's addicting, but what about for say soft drinks? I mean, are people addicted to soft drinks just because they drink soft drinks every day?
But soft drinks are less severe than
Well, yeah,
those different
but
effects.
they still have a lot of negative side effects. And what about in that case, if you're saying severity? I mean, what about smoking, cigarettes and cigars? Why aren't they illegal, for example? And they don't even have medical uses.
So you are comparing tobacco with weed.
Yes.
So you think that tobacco and weed have the same value when it comes to consumption?
Well, if you were talking about legally, yes, sort of. As in, both are used as recreational for the recreational time, and they're used for the relaxing effects of both. I mean, I think.
Okay. Um, in different states, comparing America to Malta, there are some places which is legal and some places which is illegal. Comparing the rates of places which are illegal and legal, and the legal part has less trouble, has less not information, has less how do you say trouble when controlling this drug illegally. Do you think that now in Malta, when you introduce the marijuana legally, it will have the same effect?
Um, well, I was a bit surprised by that. I guess so. I mean, it's likely, but it's not. I mean, it's not a fact. It's maybe more probable, but Malta's more easy to contain. If it happened in America, I mean, like it would most definitely. It depends on obviously the drug enforcement here in Malta, but well, if the statistics shows that, then I guess it could be the case.
Okay. Recently, um, um, news news bulletins as well as big news agencies in Malta have declared that there is a lack of this substance in Malta. Do you think that this has anything to attach to its illegal state of mind, or is it just a drug which is not being created enough?
Um, I suppose it's because people are scared of as in being caught with it. Is it though? Is it really? It's not as much in Malta.
No, in Malta, there were reports that this drug is patients. There are 92 current patients in Malta using this drug. Are not There is not enough for every patient.
Oh. I mean, Well, I guess it's due to the fact that I mean you can't. It's not profitable as to create marijuana if it's illegal, and it's not that smart to make I don't know a company or produce marijuana, you know, for as a business standpoint. So I mean that most probably is because it's illegal. So yeah, probably I think it's because it's illegal that there's not enough.
Okay. So, another question which relates to that is that I have recently run up with a study that there are different places around the world, considering Egypt, America, even Saudi Arabia. They are studying this drug and trying to um, differentiate the PDH of it and the other segment which influences the high factor and why it is consumed. Do you think that this drug might be dangerous to alter with and arrange, or do you think that science is good enough to make us reach?
Yeah, definitely. I mean, we have to experiment to find out these sort of stuff. And I mean, I personally I study chemistry. I mean, I think it's very doable. As in, we 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 learn about lead compounds, for example, which are as in you change the active ingredient of the substance, for example. I mean, it could be the case here. It's like you substitute the main ingredient, the PDH,
The PDH, yes, yes.
and marijuana to a different, maybe less impactful.
Okay. Um, since now I have only ran into one occasion where marijuana has managed to help a person. She had different. I don't exactly know the cause, but she had different type of strokes, 200 strokes a week, and she was only at the age of 5. So,
Wow.
and they figured out that marijuana could help her, and it did. Do you think that people will um, grab that information or that stage and turn it? Oh, look, marijuana is good, and keep that mentality that marijuana is good.
Well, definitely. I mean, if it was, used in such a good way, I mean, and we're saying it helped her, as in 300, that's not a joke. Yeah, I think people would latch on to that, yes, definitely, as a good side effect.
Okay. I also researched the history of marijuana. In 1973 and before, it was legal, and you could see videos of people smoking it outside. It was so normal. It was like smoking a cigarette. And pol- polit- politically, um, they try to destroy it because of certain incomes, because of political management. Do you think that this was caused because of the profit that they were collecting, or maybe the balances and negative statements, or because it is bad? It's a bad drug?
No, definitely because of the income. I mean, I read a bit. I read a bit about it once. I think it had to do even with the thing. They used hemp for to make paper, and I think it was clashing with prices with weed. I think marijuana. I'm not completely sure, but from what I read, it was definitely not because of the health benefit of people.
Okay. Despite reading that it does not have big side effects compared to other drugs, it still does have side effects. It slows down your brain, it makes you less fast when reacting. Do you think that, for example, a person with medicated marijuana is able to drive, or is he able to maybe play sports, for example? Maybe he has some maybe injury or something. Do you think that people with medicated marijuana should be more reinforced and more looked at?
Yeah, definitely. I mean, if you're gonna drive, I mean, it still applies. I mean, okay, it could be good, but you have to consider the side effects. And I think it wouldn't be so safe to drive under the influence, even if you're taking it for medication. Obviously, it should be within a certain concentration. If in the case that you're driving, maybe a certain amount wouldn't affect you as much, maybe. But no, I think overall it should be looked at. And um, even in the case of sports, it could result in injuries as well. I think it applies to both cases, yeah. But in terms of sport, I mean, if you're taking it every day for medication, even, I mean, for both cases, it's a bit tricky. Um, I think that before engaging, as in you know that at some point you're gonna drive, I think maybe you should balance it. It should be balanced between taking the medication earlier so that after a certain amount of time the side effects will be much less and you'll be able to drive or to engage in sports much more risk free than under the effect.
Okay. So that is all for me. Thank you very much, Andrew.
No problem.
And that's it.
Yeah.
طيب.
The